So let's talk about lumps in the armpit. So you've got a lump here in the armpit and you're wondering, what could this be? Lump in the armpit can be due to different reasons. Your lump can be a boil, it could be a cyst, it could be a fatty tissue known as lipoma, it could be a swollen lymph node, or could it be cancer? So these are the most common causes of lump in the armpit. So if we look at a boil is most commonly due to a bacterial infection. So a boil tends to be quite tender to touch, red, warm, and swollen. And usually a boil would have a yellow head where it releases some pus. So that's how a boil tends to present. They tend to be quite painful. A cyst is different from a boil, but it's usually mistaken for a boil. Now, a cyst is usually like a sac-like pocket which is filled with like a jelly-like fluid. And similar to a boil, a cyst can also get infected and discharge and can become an abscess, just like a boil can also become an abscess. But a cyst, unlike a boil, is not usually due to infection. A cyst can be formed if you've got ingrown hair or if you've got a trapped oil gland for no reason. So that's how a cyst is formed. So you can also have, lipoma, which is basically a fatty tissue, which is usually a firm, soft structure which you feel and is quite mobile and fluctuant as well. Now, I also mentioned about swollen lymph node. Now, a swollen lymph node can happen when you've got a viral or bacterial infection. So if you're unwell, you've got a cold, or you've got a chest infection or throat infection, you might notice that a lump comes up in your armpit. And that lump could be a pea-sized shape, might be tender for some people, or it tends to be tender if you tend to prod around a lot as well. So a swollen lymph node can be a response to infection, and a swollen lymph node can take a few weeks, before it gets smaller and disappears. So a lot of people do tend to panic when they get a swollen lymph node because the most common reason is, could this be cancer? So we do usually advise that with any lymph node or lump that you get in your armpit, if it has been ongoing for more than 6 weeks, if it's getting bigger, then you need to see your doctor for further examination. Now, we talked about cancer as well. Now, a cancer is like more of a mass that you would feel in the armpit. It could be irregular, it could be quite hard to touch, and doesn't tend to move around because it's attached to the structures inside the armpit. Now, again, for some people, it will be obviously you cannot differentiate a cancer from a lipoma or from a cyst. So if you feel any mass, which has not been there before, you don't have to wait for 6 weeks. You can see your doctor straight away if you're concerned about any lump in your armpit. And usually with cancer, there might be other symptoms and signs. You might have loss of appetite, you might have night sweats, you might have weight loss, or you might just feel generally unwell. And again, going back to the swollen lymph nodes, we talked about swollen lymph nodes can also be due to cancer. For example, if you had breast cancer, you could have swollen lymph nodes as a result of the breast cancer. So again, if you have swollen lymph node and you're a woman, you really should be doing breast examination. Similarly, if you're a swollen lymph node and you're a man, you should also be doing breast examinations because men can get breast cancers too. And also, check your neck, for any swollen glands, because if you have a swollen lymph node in your armpit, you could have swollen lymph nodes in other parts of your body. There are lymph nodes all around your neck, the back of your head as well, and you've also got lymph nodes in your groin. Now, if you've got a boil or a cyst that's now become an abscess or painful and infected cyst, how do you treat it with home remedies? Well, you can try regular warm compresses, which is done for 10 to 15 minutes, 3 to 4 times a day. Just get a towel or a flannel, warm water, not boiling hot water, just warm water, and then just apply the warm compress there. Leave it for 10 to 15 minutes. Do this 3 to 4 times a day. But you have to be consistent and you have to be patient because you might not see, obvious results in 24 hours. So it might be something that you have to do for the next 5 to 7 days. Another tip is to go to your chemist over the counter. You can buy magnesium sulfate paste. Magnesium sulfate paste is quite good for, minor skin infections. It's good for boils. It's good for infected cysts as well. It's a paste like you can apply to the area. Again, maybe 4 times a day, and it just helps to dry out the infection. It encourages the discharge of the pus as well. And if you want to be extra, you can actually lie in a warm salt water bath. Put as much salt as you can. If you want to use table salt or Epsom salt, that's up to you. Lie in the warm salt water bath for about 20 minutes. That has the same effect as the magnesium sulfate paste. It gives a drying effect. It also kills any germs or bacteria that's on the skin as well. So you find this quite helpful. So this is how you treat a painful lump or an infected lump in your armpit, whether it's a boil or an infected cyst. Again, for swollen lymph nodes, there is not much you can do. What you can apply is ibuprofen gel, which is an anti-inflammatory, which helps to bring the swelling down. You can also apply it to the boil and the cyst as well, if it's painful, but most lymph nodes usually tend to go by themselves, once the infection is gone. Like I said, if you notice a mass that doesn't look like it's a lymph node or a boil or a cyst, you need to speak to your doctor immediately. And if you've got a lymph node that has been persistent for more than 6 weeks, then again, you also need to speak to your doctor. They can send you for blood tests, they can send you for an ultrasound scan, and if needed, a biopsy of the lump if they're not sure what it is. So I hope you enjoyed this video. Take care of yourself.